That feeling of panic when you look into the toilet bowl and notice your urine isn't its usual pale yellow color isn't just paranoia. It's a survival instinct that shouldn't be ignored. Many people don't realize that approximately 78% of adults will experience a concerning change in urine color at some point in their lives, and alarmingly, nearly 60% will dismiss it as temporary or unimportant. A groundbreaking study from the University of Michigan found that patients who ignored abnormal urine colors for more than 72 hours faced a 280% increased risk of requiring hospitalization compared to those who sought medical attention promptly. If you've ever experienced this worry or currently have concerns about your urine color, you're in the right place. Before we continue, click the subscribe button and activate the bell notification. This way, you'll become part of our urological health community, where we share real solutions that doctors rarely mention in their rushed consultations. Each video is like a detailed specialist visit, but in the comfort of your home. Subscribe now and begin your journey to understanding and managing your urological health better than ever before. Most people don't realize that your kidneys filter about 200 quarts of blood every single day to produce approximately 2 quarts of urine. This incredible filtration system is constantly working, and any disruption can manifest as changes in your urine. The color, consistency, and clarity of your urine are like a window into your internal health, providing critical information that too many of us flush away without a second glance. When it comes to urine color, there's one particularly alarming shade that demands immediate medical attention, a sign that something could be severely wrong with your urinary system or other vital organs. The color we're talking about today is bright red or pink urine, which typically indicates the presence of blood, a condition known as hematuria. While sometimes, this can be caused by eating certain foods like beets or taking specific medications, blood in urine should never be dismissed as it could signal several potentially life-threatening conditions. Take Robert, a 63-year-old construction worker from Atlanta, who noticed his urine had a pinkish tinge one morning. Having been in good health his entire life, he decided it was probably due to the beet salad he had eaten the previous night. 3 days later, when the color not only persisted but intensified to a bright red, he finally decided to visit the emergency room. Doctors discovered he had a large tumor in his bladder that was actively bleeding. According to his physician, Dr. Sarah Matthews, had Robert waited even another week, the cancer would likely have spread beyond the bladder, drastically reducing his chances of survival. Statistics from the American Urological Association show that approximately 40% of patients with blood in their urine are diagnosed with a serious urological condition, including bladder cancer, kidney cancer, or advanced kidney stones. Even more concerning, a study published in the Journal of Urology found that when blood in urine is visible to the naked eye, there's a 22% chance it's caused by malignancy in patients over 50. Let's pause for a moment. I want to ask you something personal, and I promise it's not invasive, but rather liberating. How long have you been dealing with concerns about your urine color before you finally decided to seek help? For many of us, urological problems come with embarrassment or shame that keeps us suffering in silence. If you identified with what I'm saying, I want to invite you to share your experience in the comments. It can be something simple like, "I waited X days before talking to a doctor about blood in my urine." Your comment might seem small to you, but for someone reading it who's currently suffering in silence, it could be exactly the encouragement they need to seek help. You are not alone on this journey, and your story can help create a support network that many of us wish we had earlier. Comment now, while this feeling is present, and let's together break the stigma around urological health that only makes our problems worse. Beyond cancer, bright red urine can also indicate kidney stones, urinary tract infections that have spread to the kidneys, or even a rare condition called glomerulonephritis, which is inflammation of the tiny filters in your kidneys. Jessica, a 35-year-old mother of 3, experienced bright red urine following several days of lower back pain. Initially attributing the pain to her workout routine, she ignored these symptoms until the alarming color appeared. At the hospital, doctors found she had a 7mm kidney stone blocking her ureter, causing urine to back up into her kidney. This condition, known as hydronephrosis, can lead to permanent kidney damage or even kidney failure if left untreated. Dr. Michael Chen, a leading nephrologist at Mayo Clinic, explains that the human body has remarkable ways of sending warning signals when something is wrong. Bright red urine is one of the most dramatic and urgent signals your body can produce, essentially waving a red flag that demands attention. A lesser-known but equally concerning cause of red urine is a condition called rhabdomyolysis, which occurs when damaged muscle tissue releases proteins and electrolytes into the blood. This can happen after severe exertion, trauma, or as a side effect of certain medications. The released myoglobin, a muscle protein, can cause urine to appear tea-colored or reddish and can lead to kidney failure if not treated promptly. James, a 28-year-old marathon runner, developed this condition after an extremely intense training session in hot weather without proper hydration. His urine turned dark reddish-brown, and he experienced extreme muscle pain. Fortunately, he recognized something was seriously wrong and sought immediate medical care, which prevented permanent kidney damage. A survey conducted among emergency room physicians found that patients with visible blood in their urine who delayed seeking treatment for more than 48 hours had a 33% higher rate of complications and required hospitalization stays that were, on average, 2.5 days longer than those who sought immediate care. The financial impact is substantial as well, with delayed treatment resulting in medical bills averaging $12,000 higher than cases caught early. What makes red urine particularly dangerous is that the underlying causes often produce few other symptoms until the condition has advanced significantly. Bladder and kidney cancers, for instance, are often called silent killers because they typically don't cause pain or discomfort in their early stages. This makes that red flag in your toilet bowl all the more important as an early warning system. Dr. Elizabeth Kovach, Director of Urology at Northwestern Memorial Hospital, emphasizes that, in my 25 years of practice, I've never once regretted investigating a case of blood in urine. But I've had countless situations where I wished patients had come to me sooner, when they first noticed this symptom. So what should you do if you notice your urine is bright red or pink? The answer is simple. Seek medical attention immediately. Don't wait to see if it resolves on its own. Don't assume it's from something you ate, and don't let embarrassment prevent you from getting help. If it's after hours, go to an urgent care facility or emergency room rather than waiting for an appointment with your regular doctor. Time truly matters when it comes to this particular symptom. While waiting for medical care, drink plenty of water to stay hydrated, but do not use this as a replacement for professional medical attention. Also, try to collect a sample of the urine in a clean container if possible, as this can be helpful for doctors to analyze. What about other concerning urine colors? While bright red is perhaps the most alarming, several other colors can indicate serious health issues. Dark brown urine that looks like cola or tea can indicate liver disease, muscle breakdown, or certain types of porphyria. Orange urine might signal dehydration, liver issues, or bile duct problems. Cloudy white urine often indicates infection, particularly urinary tract infections. And blue or green urine, while rare and often caused by food dyes or medications, can sometimes indicate a rare genetic condition or certain types of bacterial infections. However, none of these typically represent the immediate medical emergency that bright red urine does. Patricia, a 71-year-old retired teacher, noticed her urine had become increasingly dark over several weeks, eventually resembling strong tea. She mentioned it during a routine checkup, leading her doctor to order liver function tests. These revealed early-stage primary biliary cholangitis, a type of liver disease that, when caught early, as in Patricia's case, can be effectively managed with medication to prevent progression to cirrhosis. I would have never thought my urine color could save my life, Patricia shared. It wasn't bright red, so I didn't think it was urgent, but I'm grateful I mentioned it rather than ignoring it. According to the National Kidney Foundation, adults should urinate between 4 to 7 times daily, and the color should typically be pale yellow, similar to lemonade. If your urine is completely clear, you might actually be overhydrated, while dark yellow indicates you need more water. But any shift toward red, orange, brown, green, blue, or cloudy white warrants attention. A simple way to monitor your urinary health is to glance at the toilet bowl before flushing. This 2-second habit could literally save your life by catching concerning changes early. Modern medicine has made remarkable advances in treating urological conditions, with success rates for early-stage bladder cancer exceeding 95%. Even conditions like large kidney stones, which once required invasive surgery, can now often be treated with minimally invasive procedures like lithotripsy, which uses shock waves to break stones into smaller, passable fragments. But these treatments are most effective when conditions are caught early, which is why that moment of alarm when you see red urine should never be ignored. The impact of delaying treatment for urological conditions extends far beyond the physical complications. Many patients report significant psychological distress, including anxiety and depression, after receiving a diagnosis that could have been addressed earlier had they not ignored the warning signs. Mark, a 58-year-old business executive, ignored blood in his urine for nearly 6 months, attributing it to his blood pressure medication. By the time he sought medical attention, his bladder cancer had advanced to stage 3, requiring aggressive chemotherapy in addition to surgery. The worst part wasn't even the physical suffering, Mark recounts. It was knowing that I could have avoided most of this if I'd just responded to that first warning sign. The guilt and regret were almost harder to bear than the treatment itself. A psychological study from Stanford University revealed that patients who delayed seeking treatment for visible blood in urine reported 45% higher levels of anxiety and 63% higher levels of regret following their eventual diagnosis compared to those who sought immediate care. This emotional burden often extended to family members as well, creating a ripple effect of psychological distress that could have been mitigated with earlier intervention. The human urinary system is one of the most efficient waste removal mechanisms in nature, processing approximately 50 gallons of blood daily to extract waste products. Any disruption to this finely tuned system deserves immediate attention. Dr. Jennifer Williams, a urological oncologist at Memorial Sloan Kettering Cancer Center, explains that the urinary tract doesn't sound alarms for minor issues. When you see blood in your urine, it's the equivalent of your body setting off a 5-alarm fire alert. Ignoring it is like hearing your smoke detector go off and deciding to finish watching your TV show before investigating. Beyond the more common causes of red urine like cancer, kidney stones, and infections, there are several rarer conditions that can produce this alarming symptom. Alport syndrome, AA, genetic condition affecting the kidneys, can cause blood in urine from an early age. Endometriosis, which typically affects the reproductive organs, can in rare cases involve the bladder or urinary tract and cause bloody urine during menstruation. Certain blood disorders like sickle cell anemia, hemophilia, or von Willebrand disease can also cause blood to appear in urine. Laura, a 42-year-old software engineer, experienced recurring episodes of blood in her urine for years before being diagnosed with a rare condition called nutcracker syndrome, where the left renal vein becomes compressed between the aorta and superior mesenteric artery, causing blood to back up into the kidney. I saw 4 different doctors before someone finally took it seriously enough to order the right tests, Laura recalls. Each time I was told it was probably just a minor infection or that I was overreacting. I knew something was wrong, but I let myself be convinced to ignore my own body's warnings. This highlights another critical aspect of advocating for your own health: persistence. If you see blood in your urine and a medical professional dismisses your concerns without thorough testing, seek a second opinion. The consequence of ignoring this symptom is simply too great to accept reassurance without proper investigation. Research from the Cleveland Clinic shows that patients who advocate strongly for themselves when presenting with hematuria receive a definitive diagnosis an average of 37 days sooner than those who accept initial reassurance without sufficient testing. The economic burden of delayed diagnosis for conditions causing blood in urine is staggering as well. A comprehensive analysis from the Healthcare Economics Department at Johns Hopkins University found that the average cost of treating advanced bladder cancer that could have been caught at an earlier stage exceeded $187,000 per patient, compared to approximately $38,000 for early-stage treatment. Multiply this across the healthcare system, and we're looking at billions in potentially avoidable medical costs annually. For those concerned about the embarrassment of discussing urinary symptoms with a doctor, remember that urologists and other medical professionals deal with these issues every day. Dr. Richard Nolan, Chief of Urology at Massachusetts General Hospital, puts it bluntly. In my 30-year career, I've discussed urine with over 20,000 patients. It's as routine for me as discussing the weather is. For most people, the 2 minutes of potential embarrassment in my office is nothing compared to what could happen if you ignore a serious symptom like blood in your urine. There are also certain demographic groups who should be particularly vigilant about urinary changes. Men over 50 have a significantly higher risk of bladder cancer, with incidence rates nearly 4 times higher than in women of the same age group. Smokers have a risk of bladder cancer that's 2 to 3 times higher than non-smokers, as many of the carcinogens from cigarettes are filtered through the kidneys and stored in the bladder. People with a family history of kidney or bladder cancer, those with chronic kidney infections, and individuals who have been exposed to certain industrial chemicals should also maintain heightened awareness of any urinary changes. The connection between occupation and bladder cancer risk is particularly notable. Workers in the rubber, leather, textile, paint, and printing industries have been found to have bladder cancer rates up to 30% higher than the general population due to exposure to specific chemicals used in these industries. Similarly, hairdressers, machinists, truck drivers, and anyone regularly exposed to diesel fumes face elevated risks. Thomas, a 59-year-old printer who had worked with industrial dyes for over 30 years, dismissed the occasional appearance of pink-tinged urine until a mandatory company physical led to a bladder cancer diagnosis. I knew there were risks in my industry, but I always thought it would happen to someone else, not me, Thomas reflects. Now I tell everyone in my shop to take any change in urine color seriously, especially if they've been in the business for years like I have. Beyond industrial exposure, certain medications can also cause blood in urine as a side effect. Blood thinners like warfarin, heparin, and even daily aspirin can sometimes lead to urinary bleeding. Certain antibiotics, particularly those in the penicillin family, may cause inflammation in the kidneys that results in hematuria. Cyclophosphamide, a chemotherapy drug, is known to irritate the bladder lining and cause bleeding in some patients. However, it's important to note that even if you're taking one of these medications, visible blood in your urine should never be dismissed without medical evaluation. Always consult with your healthcare provider before discontinuing any prescribed medication. Looking at international perspectives. It's interesting to note that awareness of the significance of blood in urine varies greatly across different healthcare systems. A comparative study between the United Kingdom and Japan found that Japanese patients sought medical attention for visible blood in urine an average of 12 days sooner than their British counterparts. This difference was attributed primarily to cultural factors and public health education. In Japan, regular health screenings often include urine tests, and there's less stigma attached to discussing urological symptoms. This cultural difference has translated into higher early-stage diagnosis rates for bladder and kidney cancers in Japan, with corresponding improvements in survival rates. For parents, it's worth noting that blood in a child's urine should always prompt immediate medical attention. While children rarely develop urological cancers, blood in urine can indicate kidney disorders, congenital abnormalities, or severe infections that require prompt treatment. Sophia, a concerned mother, noticed pinkish urine in her 7-year-old daughter's toilet one morning. Rather than panicking, she calmly collected a sample and took her daughter directly to their pediatrician. Tests revealed a severe urinary tract infection that had reached the kidneys. With prompt antibiotic treatment, her daughter made a full recovery without any long-term kidney damage. The doctor told me that many parents would have waited or assumed it was something minor, Sophia says. I'm so grateful I trusted my instincts instead. If this video helped you better understand what's happening with your body, imagine what our other videos can do for your overall urological health. Subscribe to the channel right now and join thousands of people who have already transformed their relationship with their bodies. Here you'll find more than just medical information. You'll find understanding, practical solutions, and a community that knows exactly what you're going through. Click subscribe, activate notifications, and together, Let's build a life with less worry and more well-being. Your health deserves this attention. Remember, when it comes to bright red urine, minutes matter. Don't wait, don't rationalize, and don't let embarrassment stand in the way of seeking help. That momentary discomfort of discussing your urinary health with a medical professional pales in comparison to the potential consequences of delay. Your body is sending you an urgent message, and the wisest thing you can do is listen. Early detection truly saves lives, and in few medical situations is this more evident than with conditions that cause blood and urine. Dr. Victoria Reyes, a urological surgeon at Cleveland Clinic, shares that, "In my practice, I've seen the full spectrum of outcomes for patients with hematuria. Those who respond quickly to this symptom typically face simpler treatments, shorter recovery times, and significantly better prognoses. The difference between seeking help immediately versus waiting just a few weeks can quite literally be the difference between life and death in some cases." The advances in diagnostic technology for urological conditions have been remarkable in recent years. High-resolution CT urography can provide detailed images of the entire urinary tract in minutes. Blue light cystoscopy allows urologists to detect bladder tumors that might be invisible under standard white light examination. Genetic markers in urine can now identify certain types of cancer cells even before they form visible tumors. But none of these technological marvels can help you if you don't take that first crucial step of seeking medical attention when you notice blood in your urine. As we conclude this important discussion, remember that paying attention to your body's signals isn't being hypochondriacal, it's being responsible. Your urological health is too important to leave to chance or to surrender to embarrassment. That moment of concern when you notice bright red urine should be embraced as a potentially life-saving warning, one that deserves immediate action. Your future self will thank you for listening to what your body is trying so desperately to tell you.